Thank you, Cara, and good afternoon, everyone. I always approach speaking on a topic like this with some humility because I'm not a health academic, I'm not a health professional, but health has somehow been around all my professional life. Well over 3 decades ago, I was New Zealand's Minister of Health and responsible for the health system. As a Prime Minister, you always keep an eye on the health system because it has potential to cause enormous grief politically if it's not well looked after and supported. When I went to UNDP, I found that it had stepped into a space which no one else could have, which was administering sizable funding from the Global Fund for fighting TB, AIDS and malaria to actually get it out into some of the most challenging and fragile environments. And then when I left UNDP, people kept saying, Helen, would you get involved with this, that and the other, including this alliance? And I've really had a lot of satisfaction from contributing through Partnership for Maternal, Newborn and Child Health, various Lancet commissions, the Countdown Series Advisory Board on Climate and Health, and of course the Independent Panel on Pandemic Preparedness and Response. So as I say, health has been around my life, but I'm new to the Alliance as the board chair, and of course appreciate the very rich history that it has and those who've shaped it, and wonderful to hear Anne Mills talking a little about that. I mean, it's not a simple decision to go and be hosted by WHO, and she referred, to the politics and the context. So good to be reminded of those early choices and of the reason for establishing the alliance. Of course, it was set up 25 years ago. The world was a rather different place at that time. Health systems always face new challenges. We're in a different era. And health systems are having to grapple with this syndemic of crises, which all end up linking one way or another and increasing risks. And I was going to just briefly, sort of at a headline level, refer to those. Demographics, for example, have changed quite dramatically. In 2020, and I'll use that as a sort of base year, the number of people aged 60 years and older outnumbered children younger than 5, and more of half the world's population was urbanised. This is a different health context. I should say in brackets that I support my father, who's 101, so I've become an expert in the care of the old as well, and the importance of care services. But this is increasingly our world, isn't it? We're grappling with fewer children and a very large older population. Then there's issues of governance and how they impact on our health systems and trust in them. Freedom House's research marked 2020 as the 15th consecutive year of democratic decline associated with eroding trust in institutions. Now, didn't we see that play out with the pandemic? Actually, from really both ends of the argument, if you like. Watching the argument here in the UK about how it was handled, and the editor of the Lancet saying, this is the worst public health failure in British history. Well, it doesn't. Of course, that's not good for faith in institutions. But then at the other end, you had the development of the anti-vax, anti-science constituency, which has dogged all our countries, really, and the distrust that has brought to public health and health systems. And I really worry now about our ability to boost childhood immunisation when these kinds of, there was always a group, I knew as Minister of Health, that didn't want their children immunised. But is that group growing fast now? And what are the implications of that for the return of basic and deadly childhood diseases? Then you have this extraordinary epidemic of fragility and conflict around our world, with profound consequences for health and well-being, obviously. When I first went to UNDP, for about a year, they used to supply me with notes saying that the number of conflicts in the world was really at record lows. They soon stopped supplying those notes, particularly from about the time the Arab Spring turned into the Arab Winter, and all hell let loose with many conflicts. But since then, the long sad list has grown. Of course, 2020, we also saw the emergence of COVID as a public health emergency of international concern, a designation which is still not lifted, and we could talk all day about the implications of that. And then the implications for health and well-being and health systems of what's happening with our climate ecosystem, and the dislocation of entire communities, and of course food and water shortages and the implications of that. So all of these crises coming at us at once present obstacles to health and well-being of individuals and of whole societies. And a common thread across them all is that they disproportionately affect the most marginalised in our populations, and they're made worse by our underlying pandemic of inequities as well. So, if we take them all together, these crises have contributed to a regression from hard-won progress on human development made during the era of the Millennium Development Goals. We saw, for example, in 2021, global immunisation coverage drop to 81%. We've seen global extreme poverty rates go up in 2020, the first time this century, up to 9.3%, obviously putting a zero poverty target by 2030 for the SDGs increasingly out of reach. It was looking hard to achieve that target before the pandemic, and it looks, damn near impossible now. So all of the crises exacerbating the strains already being felt by our health and social systems as they strive to deliver for their populations, and of course added strain on the health workforce. And let's not, the numbers of key health workforce personnel that we are short is just so mind-boggling that one fears for the future of systems without some dramatic initiatives there. We have the growing burden of the non-communicable diseases, now accounting for 74% of deaths globally, with 77% of those deaths occurring in the low and middle income countries. It's not that long ago that NCDs were dismissed as a problem for rich countries. Not anymore. This is a global challenge. And countries across income levels are struggling to tackle the social and commercial determinants of health that are driving the NCD's epidemics, not least, I should say, junk food and sugary drinks, tobacco and alcohol. Health systems are also struggling to deliver high quality care for those with chronic conditions, and of course the health and social care for older people with complex health needs. Even in tobacco control, which I know very well, having implemented New Zealand's Smoke-Free Environments Act of 1990, which at the time was the state-of-the-art legislation, and it's been tightened ever since. Globally, there is not being implemented all the measures we know will work to reduce consumption of tobacco, including very high taxes on the product. So a major challenge now, I think, is to construct and sustain and implement policy across different thematic sectors to promote health. Crucial for the NCDs, crucial for pandemic preparedness and response, crucial for the health system interacting in a meaningful way with policy and systems coping with all the crises we face. And among the failures observed during the COVID-19 pandemic, which I reviewed as co-chair of the independent panel for pandemic preparedness and response, was inadequate governance at the global and national levels for health, and we could not coordinate effectively across sectors. That needs whole of government and whole of society coordination. Other failures we observed related to lack of resilience of health systems during the pandemic. And as everyone here will know, under the pressure of COVID, access to essential services faltered from high income to low income countries, including for access to sexual and reproductive health and for the detection and treatment of cancer and other serious conditions. And there'd also been an inability to keep attention on pandemic preparedness over time, meaning actually that most countries weren't ready to face a threat of that kind. So, in a world of increasing extreme weather events, at a time when the emergence of new infectious disease threats is accelerating, attending to failings in systems, such as a lack of resilience and suboptimal governance, becomes very, very important. So, to come to the point, I certainly believe that policy and systems research can make a major contribution to addressing these challenges, which is why I'm excited to chair the Alliance. By studying policies and systems, we can identify the barriers to and the drivers for achieving health equity, and we can identify solutions. The field of research brings together policymakers, program managers, clinicians, communities, researchers to ensure that the right questions are being asked and answered. And with a field and community that is now mature, the Alliance can place a greater focus on the actual impact of the research it supports in helping health systems respond to the many challenges they face, and on building those systems which are both resilient and able to adapt to changing contexts. Over the last quarter century, the Alliance has brought partners together to work on solutions to major challenges within health systems. Nigeria, for example, in partnership with Gavi, the Vaccine Alliance, and UNICEF, it supported participatory action research, which helped reduce the rates of unimmunised children in 2 districts from over 50% to under 10%. In India, it worked with the government to improve the rollout of one of the world's biggest national health insurance schemes. Going forward, of course, the Alliance will still work on those traditional health systems research issues, and particularly supporting the drive towards universal health coverage. But this week, while we're in London, we're discussing the future strategy and how we also look at the linkages with this broader context that I've been speaking about. What contributions can the field make to addressing health emergencies, social and commercial determinants, and the climate crisis, where action both within and beyond the health sector is needed? The Alliance can help respond to changing demographics by investigating innovative models of care delivery and identifying appropriate roles for digital technologies. It can help identify and document the most effective pandemic preparedness and response strategies, as well as the social, economic, and other factors that shape them. And the Alliance has already begun supporting the development of climate-resilient health systems, which can be better equipped to manage the impacts of climate change. So, at this critical juncture in global health, there is a clear role for health policy and systems research, addressing those complex, interlinked crises facing our world, which have such an impact on human health and well-being and our health systems. The community with which the Alliance works, including all of you, has skills which range across policy analysis, understanding political economy, implementation research, and systems thinking, competencies which are essential tools for developing health and other systems fit for purpose for our current world and tackling those crises. We need to prioritise research which addresses the root causes of health inequities and promotes social justice. We need to embrace innovation and use technology to improve health outcomes and increase access to care. We need to advocate for policies which prioritise health equity and promote sustainable development. And I hope the Alliance going forward will be able to support continued efforts and build new partnerships to meet these evolving needs. Thank you.